Implicit bias. Recognizing and addressing implicit bias in hospice care. What is explicit bias? Explicit bias is intentional prejudice, discrimination, or hatred towards individuals or groups based on their religion, ethnicity, gender, age, sexuality, beliefs, income, or politics. What is implicit bias? Implicit bias refers to the automatic, unintentional stereotypes and prejudices that affects our judgments and decisions. Patient-centered care requires our team to have an awareness of the biases that may impact our care decisions. Implicit bias can significantly impact various aspects of hospice care, including pain management, underestimating or overestimating pain levels based on patient demographics, delaying or withholding pain medication due to biases about addiction or tolerance, failing to consider non-pharmacological pain management options due to biases about effectiveness. Communication. Misinterpreting or dismissing patient concerns due to language or cultural barriers. Using jargon or complex medical terms that confuse patients. Failing to actively listen to patients' needs and concerns. End-of-life experiences. Making assumptions about patients' end-of-life wishes based on demographics or stereotypes. Failing to address spiritual or cultural needs at the end of life. Delaying or denying access to hospice care due to biases about prognosis or eligibility. Company culture. Creating a culture of exclusion or marginalization among staff members from diverse backgrounds. Fostering a culture of silence or tolerance around biased behaviors. Overlooking or downplaying the impact of implicit bias on patients' care and staff well-being. Implicit bias can lead to disparities in care, misunderstandings, and unmet needs. Recognizing and addressing implicit bias is crucial to providing inclusive, patient-centered care and fostering a positive company culture. Let's review some examples of implicit bias. Here are some examples of racial and ethnic bias in hospice care. Delaying or denying hospice admission to patients from diverse backgrounds due to assumptions about their prognosis or eligibility. Underestimating or overestimating pain levels based on patient race or ethnicity. Failing to provide culturally sensitive care, such as ignoring dietary restrictions or spiritual practices. Using language or communication barriers as a reason to withhold information or involve family members in care decisions. Stereotyping patients based on their race or ethnicity, leading to inadequate or inappropriate care. Overlooking or downplaying the impact of systemic racism on patients' health outcomes and experiences. Failing to provide translation services or interpreters for patients with limited English proficiency. A study found that white hospice patients received more opioid pain medication than Black patients, even when controlling for pain severity. It's essential to recognize and address these biases to provide equitable, patient-centered care and ensure that all patients receive high-quality hospice care. Ageist bias in hospice care can manifest in various ways, including assuming older patients are more accepting of death and less deserving of aggressive treatment, overestimating or underestimating older patients' capacity for decision-making, failing to address unique needs and concerns of younger patients, such as those with young families, assuming older patients are more frail or vulnerable than they actually are, delaying or denying hospice admission to older patients due to age-related biases, focusing more on comfort care for older patients while pursuing more aggressive treatments for younger patients, ignoring or downplaying the concerns and needs of older patients' family members, failing to address age-related health disparities and inequities in access to hospice care. Recognizing and addressing ageist bias is crucial to providing person-centered care and ensuring equal access to quality hospice care for patients of all ages. A study found that older adults were less likely to receive palliative care consultations and more likely to receive aggressive treatments. Sexual orientation bias in hospice can show up in various ways, including assuming a patient's sexual orientation or gender identity based on stereotypes, using heteronormative language or assumptions in care discussions, failing to recognize or respect same-sex partners or spouses as equal decision makers, ignoring or downplaying the unique needs and concerns of LGBTQ+ patients, making assumptions about patients' values, beliefs, or preferences based on sexual orientation, failing to provide inclusive and welcoming care environments, delaying or denying hospice admission to LGBTQ+ patients due to biases, not having policies or procedures in place to support LGBTQ+ patients and families. A study found that LGBTQ+ patients reported lower levels of family involvement in care decisions, potentially due to implicit bias from healthcare workers. Recognizing and addressing sexual orientation bias is crucial to providing inclusive, person-centered care and ensuring equal access to quality hospice care for all patients, regardless of their sexual orientation or gender identity. Disability bias in hospice care can present in various ways, including assuming patients with disabilities are more burdened by their condition than they actually are, failing to provide accessible care environments, such as wheelchair-accessible facilities, ignoring or downplaying the unique needs and concerns of patients with disabilities, making assumptions about patients' quality of life or capacity for decision-making based on their disability, failing to provide accommodations, such as sign language interpreters or Braille materials, delaying or denying hospice admission to patients with disabilities due to biases, focusing more on the disability than the patient's terminal illness, lack of education and training on disability issues for hospice staff, using language that perpetuates stigma or stereotypes about disability. A study found that patients with disabilities were less likely to have advanced care plans in place, potentially due to implicit bias from healthcare workers. Recognizing and addressing disability bias is crucial to providing inclusive, person-centered care and ensuring equal access to quality hospice care for patients with disabilities. Cultural bias in hospice care can manifest in various ways, including assuming patients from diverse cultures share the same values, beliefs, and practices, failing to provide culturally sensitive care, such as ignoring dietary restrictions or spiritual practices, making assumptions about patients' end-of-life wishes based on cultural stereotypes, failing to address cultural differences in communication styles, such as direct versus indirect communication, not respecting cultural differences in mourning and bereavement practices, failing to provide culturally appropriate educational materials and resources, Not having a diverse hospice staff that reflects the patient population. Not providing ongoing cultural competency training for hospice staff. A study found that patients from diverse cultural backgrounds reported inadequate spiritual support, potentially due to implicit bias from healthcare providers. Recognizing and addressing cultural bias is crucial to providing person-centered care and ensuring equal access to quality hospice care for patients from diverse cultural backgrounds. Socioeconomic bias in hospice care may present in various ways, including assuming patients from lower socioeconomic backgrounds are less educated or less capable of making informed decisions. Failing to provide equal access to hospice care due to financial constraints or lack of insurance. Making assumptions about patients' values or priorities based on their socioeconomic status. Not having sliding scale fees or financial assistance programs available. Failing to address social determinants of health, such as housing instability or food insecurity. Ignoring the impact of systemic poverty on patients' health, outcomes, and experiences. Failing to provide equal access to pain management or other medical treatments due to cost concerns. Not addressing the unique needs and concerns of homeless or marginally housed patients. Not having partnerships with community organizations to address socioeconomic disparities. Patients from lower socioeconomic backgrounds may receive fewer resources and less access to comprehensive care. Recognizing and addressing socioeconomic bias is crucial to providing equitable, person-centered care and ensuring equal access to quality hospice care for all patients, regardless of their socioeconomic status. Mental health bias in hospice care can manifest in various ways, including assuming patients with mental health conditions are less capable of making informed decisions. Failing to address mental health needs such as depression or anxiety, in addition to physical symptoms. Making assumptions about patients' mental health based on stereotypes or stigmatizing attitudes. Not having mental health professionals as part of the interdisciplinary hospice team. Failing to provide equal access to hospice care for patients with mental health conditions. Ignoring the impact of mental health on patients' quality of life and symptom management. Not addressing the unique needs and concerns of patients with dementia or other cognitive impairments. Lack of education and training on mental health issues for hospice staff. Patients with mental health conditions may receive less communication and access to the care team and have a lower quality of life. Recognizing and addressing mental health bias is crucial to providing comprehensive, person-centered care and ensuring equal access to quality hospice care for patients with mental health conditions. Biases related to substance use disorders in hospice care can manifest in various ways, including stigmatizing patients with substance use disorders or assuming they are less deserving of care. Failing to address substance use disorders as a comorbidity or underlying cause of terminal illness. Assuming patients with substance use disorders are non-compliant or less capable of following treatment plans. Not having addiction specialists or substance abuse counselors as part of the interdisciplinary hospice team. Failing to provide medication-assisted treatment or other evidence-based treatments for substance use disorders. Ignoring the impact of substance use disorders on patients' physical and emotional symptoms. Failing to provide support and resources for family members and caregivers affected by patients' substance use disorders. Lack of education and training on substance use disorders and addiction for hospice staff. Patients with substance use disorders may be approached differently, avoided, or have less access to comprehensive care and quality of services. Recognizing implicit bias in ourselves requires self-reflection. Regularly examine your own thoughts, feelings, and actions. Awareness of biases. Educate yourself on common biases and stereotypes. Open-mindedness. Be willing to challenge your own assumptions and beliefs. Feedback. Seek constructive feedback from others on your biases and behaviors. Mindfulness. Practice mindfulness to become more aware of your thoughts and feelings. Humility. Recognize that everyone has biases and be willing to learn and grow. Journaling. Write down your thoughts and feelings to identify patterns and biases. Seek diverse perspectives. Expose yourself to different cultures, backgrounds, and viewpoints. Training and education. Participate in workshops, training sessions, and educational programs. Accountability. Hold yourself accountable for addressing and overcoming biases. Remember, recognizing implicit bias is an ongoing process that requires effort, commitment, and self-awareness. Our strategy and approach includes education and awareness, self-awareness, feedback, communication, training, and accountability. Our tagline, your point of view, our priority, honored always, resonates deeply with the concept of implicit bias. By acknowledging and respecting each individual's unique perspective, we can begin to recognize and challenge our own biases. This, in turn, allows us to provide more empathetic and personalized care to our patients and families. Implicit bias can lead us to unintentionally prioritize our own point of view over others, often based on ingrained stereotypes or assumptions. By actively seeking to understand and honor the viewpoints of those we serve, we can overcome these biases and deliver care that is truly patient-centered. In essence, our tagline serves as a reminder to continually examine our own perspectives, listen actively, and prioritize the voices of those we care for. By doing so, we can create a more inclusive, compassionate, and bias-aware environment in our Honor View Hospice community. By always being willing to learn and grow, we can co-create a supportive and inclusive environment for those we serve and employ.